Welcome, ladies and gentlemen. In this video, I will be discussing classic Ehlers-Danlos syndrome. Classic EDS is an autosomal dominant disorder. It is caused by mutations in the genes COL5A1 and COL5A2. Or it may manifest as a de novo mutation in the germ cell of either parent. This basically means that you would be the first person in your family to acquire the syndrome. These mutations occur when type 5 collagen and type 1 collagen interact with each other during collagen fibrinogenesis. Type 1 collagen is found in the skin, tendons, ligaments, bones, and aorta. One of the sites affected in classic EDS are the joints. Various things can happen to the joints in classic EDS, and these include large and small joint hypermobility, joint dislocations, joint subluxations, joint effusions, and thoracolumbar scoliosis. When we talk about subluxations, to begin with, let me define the term subluxation for you. And I will use the femoral head and the acetabulum to explain what a subluxation is. The femoral head is the proximal portion of the femur that attaches to the acetabulum. If for whatever reason, trauma or any kind of accident, the femoral head is partially displaced outside of the acetabulum, while both entities are still keeping some sort of contact with each other, that is a subluxation. If the femoral head was completely displaced outside of the acetabulum and they were both completely separated, no contact whatsoever, that is a dislocation. If a patient presents with joint subluxations and they have classic EDS, they will most likely present with subluxations in the shoulders, the patella, and the temporal mandibular joint. Another site in the human body that is affected in classic EDS is the skin. The skin will become hyperextensible and weak. Therefore, the skin will tend to tear easily with any type of trauma, heal slowly, and bruise often. On physical exam, you may encounter Mettner's sign. Mettner's sign is when the upper eyelid is easily averted because of this hyperextensibility of the skin. There are three key skin features that may be present in a patient with classic EDS. And these are piezogenic papules, molluscoid pseudotumors, and subcutaneous spheroids. Pisogenic papules are fat herniations through the medial and lateral fascia of the feet. Molluscoid pseudotumors are bluish-gray, violet-like, 1 to 2 centimeter nodules over bony areas caused by subcutaneous fat through wasted dermal scars. Subcutaneous spheroids are hard subcutaneous nodules due to fat necrosis. These are the key skin features in a patient with classic EDS. Now, let's talk about diagnosing a patient with classic EDS. To diagnose a patient with classic EDS, you need 3 things. You need major criteria, minor criteria, and diagnostic testing. The major criteria for classic EDS are hyperextensibility of the skin, hypermobility of the joints, and widening atrophic papyraceous scars with poor wound healing. And these papyraceous scars will look similar to the rolling paper of a cigarette. The minor criteria for a classic EDS are muscle hypotonia, developmental delay, hernias, anal prolapse. These patients will get cervical insufficiency, a positive family history, and any of the previously mentioned skin features. Diagnostic testing consists of DNA sequencing of COL5A1 and COL5A2. Ladies and gentlemen, this has been my presentation for classic EDS. I hope it helped. Thank you for watching.